So the next speaker is Dr. Nishi Prasad, fellow at GMC Bhopal.
Dr. Nishi Prasad is there?
Okay.
Oh, Acha, please.
Good morning, everyone. So, my topic is fetal hemoglobin and development of ROP in preterm babies. So, the incidence of ROP in India is very high, 38% to 50%, and only few studies are related to the protective factors. Most of the studies which are published are related to risk factors. So, fetal hemoglobin is one of the protective factors. Only 2 studies in literature have been reported so far between correlation of fetal hemoglobin, blood transfusion and ROP. So hence we choose this title, and our aim of the study was to correlate between fetal hemoglobin concentration, blood transfusion and ROP in preterm infants. This was a prospective observational study for a period of 1 year at GMC Bhopal, and all preterm babies with less than 36 weeks and less than 2 kg birth weight were included in the study. So all preterm neonates were divided into 2 groups, ROP and no ROP. ROP group was further divided into those infants who showed progression, those who regressed after treatment and without treatment. So the concentration of fetal hemoglobin was quite low in the ROP group compared to those in no ROP group. And there was inverse correlation between the staging of the disease and the fetal hemoglobin concentration. Lower the staging, higher was the fetal hemoglobin concentration. Those infants who progressed had lower fetal hemoglobin concentration compared to those who regressed. Blood transfusion and volume of blood transfusion was positively associated with the development of ROP. So ROC curve, predictive ability of fetal hemoglobin, area under the curve was 0.976 with very high sensitivity and specificity. So the concentration of fetal hemoglobin was less in ROP group, and there was a sharp demarcation at around 56% of fetal hemoglobin between ROP and no ROP groups. Fetal hemoglobin was significantly lower in the ROP group than in non-ROP group. Higher the concentration, lower was the staging of the disease, and the probability of developing ROP and its progression was less in infants with fetal hemoglobin more than 60%. So this is the first Indian study and third worldwide study between fetal hemoglobin, blood transfusion and ROP, concluding that replacing fetal hemoglobin by adult hemoglobin during blood transfusion may promote the development of ROP. Conclusion: replacing fetal hemoglobin by adult hemoglobin during blood transfusion may promote development of ROP. Conversely, maintaining higher levels of fetal hemoglobin may be protective for developing ROP. So our recommendation is that adult blood transfusion should be given with caution in susceptible preterm babies, as it dilutes fetal hemoglobin level, thereby increasing the risk of ROP. This is a multi-center randomized trial born study going on, suggesting cord blood cells transfusions to reduce the severity of ROP in extremely low gestation age.
Yeah, time is up.
That's it. Thank you.
So you have any questions?
No.
How will you collect the sample?
Sample was collected for all the preterm infants who had come for ROP screening, sir. We had sent 3 ml of blood sample of the baby to the pathology laboratory for fetal hemoglobin estimation by chromatography method, high performance liquid chromatography method, at the first visit and also at the follow-up after 1 month.
But your study timeline is too short.
1 year, sir. Yes, sir, my thesis was like for 1 year study, and after that, for the last 6 months, we had made tables and discussion. Yes,
How
sir,
many
so the
ROP? How many ROP you seen in your cases? Means your study?
Yes, out of 4, we had taken total 410 preterm infants, out of which 300 was no ROP and 110 was having ROP. So the incidence was 26.8% in our study, sir.
Is the fundus examination was done immediately after the transfusion, or?
Yes, sir. Yes, sir. Fundus examination was done, and the ROP was staged according to the ICROP guideline 3, and then we had sent for the fetal hemoglobin blood for the fetal hemoglobin estimation.
In fundus examination, which stage is most commonly seen in your study?
Sir, those infants who had a lower fetal hemoglobin levels, in them stage 3 was most common, sir. And those infants who had higher fetal hemoglobin levels, they were like kind of protective in our study with stage of 1.